This is No Spin Live, and do we have a show for you today? We're going to talk about Adele. What is going on with her? A big makeover. She looks completely different. A lot of speculation, but our experts are going to tell you exactly what the deal is. It's going to be full throttle, and we've got three incredible experts for you. We got Dr. Charlie Messa from Weston, Florida, Dr. Jason Pozner from Boca Raton, Florida, and last but not least, Dr. Christina Hamori, not from Florida, but from Boston, Massachusetts. All right, so I got a question for y'all first before we get into Adele. So I have patients keep coming and asking me, like, do we really need to wear masks? So I'm just wondering, what do y'all tell your patients about that question? Charlie, you want to lead off?
Yeah, we required in Broward County in Florida, because we have an increased number, not as high as Miami-Dade County, but increased number. So the requirement in this county is to wear a mask in public.
Yeah.
And the reason I have them wear masks in our office, because my feeling and some of the evidence shows if you can't be socially distant in terms of 6 feet apart, you're going to potentially come in closer contact with someone, the mask will help protect you and the patient if someone is potentially asymptomatic or has been exposed and hasn't quite become symptomatic. So I have them wear it in the office, and we wear it. They wear a mask. I wear a mask. It's a little awkward, because I like to see a patient's expressions, interact with them, but I think it's the safest thing for all, and they feel more comfortable too, which is very important.
Christine, what do you think? I mean, you're from Massachusetts. I'm surprised you're not wearing a hazmat suit, but
yeah, the governor still would like us to, I bet. But basically, I think we use masks because the rules are that we have to use them here. But honestly, when they come in and start chit-chatting, their mask is off, and I have mine on because I can just feel them raining on me with there's, in these small rooms. So I do encourage a mask. We don't do any testing unless they're surgical patients, but I do think, if you can't social distance, masks are a good idea because it mostly protects people around you, not so much yourself, even though I don't think that's why people think they wear them. They wear them because they think they're protecting themselves. But we try to enforce it in the office. But when the patients aren't there, I feel like my office is a pod and we don't wear masks when we're amongst each other.
Yeah. Jason, you saw patients today, probably a bunch of them. So what did you tell them?
I had a full day today. I'm, same boat as Charlie is, we're the next county over. So pretty much it spills over. We're all been wearing masks. And a lot of times I did a lot of fillers today. I had a clinic day today. So, if we operated on your face, your mask was off. If I did fillers or lasers, your mask was off. But all the body consults had kept their masks on. It's just been pretty much standard. Honestly, I'm getting used to it. And my staff here, we've all been tested in the office. So among ourselves, we've all been tested and retested. So we're all have our masks off during the day when we're not with patients. But the rest of the time, it's just pretty much business as usual with your mask on. I hate to say it, but we've all gotten used to it now. It's just, I worry more about going to the supermarket than any other place or the pharmacy. That's where I get scared because I don't know.
Come on, Jason, don't be a wimp. That's like well, I think, those are great points. I was actually also kind of asking more. I think the question I get more is well, not necessarily in the office because I think there's protocols that we're all following, but really outdoors and things. Because I think same thing in Dallas, same as you all. We have an order to wear masks in all public places, and I think most people are doing it. I do think that there's probably no really great scientific evidence or data to support that masks help, but they probably don't hurt. The only thing I would say is, and actually Anders Tegnell, who's the lead, he's kind of the Fauci of Sweden, he says that they're not using masks in public because they're worried that people, exactly what Charlie said, that people think they wear masks and they don't have to socially distance. And he said the social distancing is actually more important. So I think if you're cognizant of the distancing, wearing a mask is certainly not going to hurt you, but you shouldn't think the mask is going to protect you.
Yeah. And, I see some people wearing masks. I'm driving by and they're by themselves in the car with the mask on.
Right. They have really bad breath.
Yeah, exactly. All right, well, let's get into our feature story. So Adele, everybody knows her and they've seen the pictures like, oh my God, I think she lost 100 pounds, and there's a lot of speculation. And did she have this done? Her cheeks look fuller and her eyes look smoother and her chin is more forward and all these different things. So Jason, you started off because you brought the story to us. What do you think?
The thing is this, I commend her on her weight loss. bottom line, you lost 100 pounds, good for you. Whether you had surgery or whatever else, or just exercise and dieting, good for you. So everyone on this call has been in this business for a while. None of us are newbies. And we've seen some people who lost 10 pounds who everything fell. And you see other people who have pretty good skin quality that lost 100 pounds that the skin pretty much retracted well. So I don't really know. I wasn't there during her weight loss, but if she's 32 years old and if her skin retracted good enough to cover all that weight loss, good for her. If not, we have options. That's why we're in business. You know, if someone lost weight and has a little saggy skin, we have a lot of options from surgery to non-surgery to fillers to kind of fix some of that. So, you know, it's funny, all these tabloids are like, oh, Adele, what filler did you have? I'm like, good for her. You know, she can afford it. You know, she's not spending her last dime on fillers in my office. So, you know, good for her.
I mean, she's a pretty woman and is genetically blessed, I think, with beautiful bone structure that maybe was hidden a little bit when she had a little chubbier face. And now, I mean, it could be natural.
Do you think she had fillers? Do you think she had fillers?
I don't think so. I think she has nice skin. She's young enough. She shrunk down. I mean, maybe some Botox. You know, her forehead looks a lot smoother. It's hard to tell, you know, because she had a huge amount of change in her face as far as weight loss. But I don't know. What do you think, Charlie?
Well, they're saying that her eyes look a little wider, they're a little smoother, and that kind of that lateral canthal, that crow's feet area. So probably a little bit of Botox or another neurotoxin to smooth out the area, and then maybe a little bit of a filler into the cheekbone area, because with the weight loss, she probably lost some of her facial fat. So maybe it's giving her more of a sculpted look in her kind of the jowl, just above her jowl area. So kind of like when that fat pad is taken out, the buccal fat pad. So she probably makes her even look like she has higher cheekbones because her face is not as full. And maybe a little bit of more definition along her jawline, her mandibular border, her chin, to give her a little more structure to her face with filler, and which is not unusual. You're in your 30s, that's when you start seeing some of the early subtle signs of aging, and this is a good time to be doing fillers.
Yeah. You know, we do a lot of jawline fillers. I mean, it was funny. It was popular, then it kind of fell off when everyone went through the voluma cheek-wise. And now I can tell you, like, a ton of filler in the jawline. I mean, my go-to still for the jaw for years has been Radius. I love that for the jaws. And you can really build up their jawline really nicely. And the one thing is we notice a lot of asymmetries where left, right, people are a little bigger on one side. But when you fill their jaw, it does pick up the neck. It's a nice, quick, cheap fix. And some good long-lasting filler. It's just not real forgiving, so I wouldn't go to a real newbie for Radius because you can't reverse it. But beautiful filler that we do quite a bit of.
Charlie, do you use a cannula, Jason?
You know, I don't. I like cannulas for certain things. I will use when I'm doing temples and hands with Radius. I do mix it 1-to-1. So 1.5 to 1.5, and I will use a cannula, but I like a needle around the jaw because just on the bone, a super periosteal injection.
Charlie, I want to follow up on you mentioned her eyes look smoother. That's what the tabloids are saying as well. So there's some things like if you lose weight, sometimes the bony structure and definition, some of the things can get better, but oftentimes, you know, your eyes typically don't look smoother because usually you have some skin that will develop. So what types of things can people do if they feel like, you know, they've got some wrinkles under their eyes, for example?
So in that scenario, like when you lose fat around the eye, which happens with the aging process, you can get a more hollowed out orbit, and that actually makes you look older. So in that scenario, you could try, if it's the skin and it's a surface texture, you could do superficial laser treatments, or moderate depth chemical peels like a TCA peel, or if you need to add volume, you can use autologous fat grafting, or use a very fine hyaluronic acid filler, something like Restylane Silk, which can be diluted to make sure it doesn't lump or create irregularities. But that will add volume to that tear trough of the area between the cheek and the nose and the lower lid, and that will give you a more youthful appearance if you've lost volume in that area.
Yeah. I like Belotero for that. I mean, that's my go-to for lower lids. I've been doing that for years because it doesn't tindle. But again, Restylane Silk, or like what you don't want to put in the lower lids is a thick filler like Juvederm. Right. You know, Juvederm Ultra Plus is a very hydrophilic filler. So sometimes the people come in like they've had it done to their lower lids, and I love Juvie for lower face, but in the upper face, in its current Juvederm, it'll carry a lot of water, so you'll end up really swollen in your lower lid. So just generally don't use Juvie Ultra Plus in the lower lids. And in terms of laser, like you said, Bill has a Cyton. Our Cyton is the go-to for laser resurfacing in lower lids. That's my favorite. I had that done a couple years ago as well.
Looking good.
You did like total resurfacing with erbium, or are you doing halo, or what do you do?
Well, for lower lids, there's really two options for me. My go-to is generally full resurfacing. I have my standard settings that I've been doing for years, but like if someone is a little younger who doesn't have the downtime and doesn't quite have the number of lines, then I use for fractional ablative with a little bit of coag. I love that for my lower lids and patients who can't do deep resurfacing.
Christine, what do you think?
I like to do a lot of transconch blepharoplasties, and I find that I use a fractional CO2 on the lower lids, and it really changes result. Avoiding the incision, improves skin quality. Patients really love it. And you guys were mentioning how to open the eye. I think temple filler helps open the eyes a lot too.
Yeah, I totally agree.
Yeah.
Also, a little bit of filler along the bony structure of the upper lid, sometimes it helps. It's funny, like if you talked about this and we were doing this 15 years ago, we'd be like, nah, we're in surgery. We don't have time for that. But like we do a lot of this now, and it's very complementary to surgical options. And that's why, like, I always say that plastic surgeons we have a bigger golf bag. We have like lots of different tools from surgery to non-surgery to give the patients a good option. Like I just did a virtual consult, and we were talking about this lady needed a facelift, and it was a secondary face. And I said to her, if you went to someone who would just fill you, you would have an overfilled face because it wouldn't correct the problem, which was, banding and lax skin. So we have different options, and a lot of times it's surgery plus non-surgery or just non-surgery. I mean, it's a good time to do stuff. We have a lot of tools for patients. Yeah,
that's actually probably a good reason to go to a board-certified plastic surgeon for some of these things, just because, just like I said, Jason, it's a bigger golf bag. I mean, if you're just, if you've never done surgery, you've never seen the anatomy, there's just certain things you're not going to be able to understand or relate to, or maybe you can follow the directions for certain people, but sometimes you have to kind of redirect a little bit, right, Charlie? I mean, there's an artistic sense there's a surgical artistic sense that's very kind of important in the essence of what we do, I think.
I agree with you 100%. And when you look at facial aging, it should be looked on a multi-dimensional plane. The skin surface, the volume of the face, the laxity in the skin. So if you just use fillers, you're only taking care of one dimension. So you really need to look at all the different layers of the face in terms of adding volume, treating the skin surface, and then if you need to redrape or remove skin, that's got to be another component of it. So every patient has to be assessed from that individualistic standpoint.
It's funny, I was on the phone with Barry DiBernardo this morning. So one of the things Barry and I were talking about is actually that this is an age of high-tech aesthetics, that, we are able to offer the patients a lot of high tech that we really were not able to do a number of years ago. So when we were all residents, all four of us, there was a knife and a fork. Plastic surgery was cut and paste and sew. That was it. And then we started getting into some toys like Vaser and ultrasonic lipo and some lasers and things like that. But it's a different world now. I mean, we grew up for this. So someone coming into this for the first time would look at it and say, well, how do I choose between this and this and this and this? But, nowadays in this instance, many of us have a lot of these high-tech toys available to really be able to give patients different options. And there's a lot of new stuff that's on the books coming out within the next few years. That's very exciting, and we'll share on Plastic Surgery Channel in the future when they become available.
All right, that's some great stuff. Thanks so much. Thanks for all those expert opinions and your time. I'm sure our viewers appreciate it too. You can see more of this on the plasticsurgerychannel.com, or you can go to our YouTube channel and subscribe.